Hello and welcome. My name is Sue Gritzner and I'm a pain psychologist at the University of California in San Francisco at the Pain Management Center. This video will cover a technique for managing pain called pacing. Pacing is a very important pain management technique, and my guess is that if you've had pain for some time, that you were already started to use and implement this technique. My hope is that by watching this video that you can find ways to optimize pacing your activities. Pacing is a way to basically optimize your activities while getting control over your pain. Before we start, I will tell you, pacing can be very difficult. That is partly because it's just very different from the way that we normally do things. It can take a lot of willpower and a lot of planning, and it can take a while to figure out what's really working for you. But if it's difficult, please don't give up. What I have found from my patients who try this technique is that a lot of them struggle at first. However, when they persist, pacing is one of the most helpful techniques that we have worked on. So let's think about pain and activity levels and how they're related. Imagine yourself on a good day. You have some energy, your pain is manageable, you have a lot to do. You get going on with your to-do list and go into various activities, and activity tends to increase by the end of the day until we reach what we call point of no return. So what is the point of no return? It's when we reach a certain level of activity wherein the pain, there's just no controlling it. We can take medication, but ultimately we need to stop activity and rest. The point of no return is typically followed by a sharp decline in activities. This leads to resting. Resting can be for an hour, for the rest of the day, sometimes even several days. It can really take up a lot of time. So once activity is low enough for long enough, activity starts to increase again. Then activity can hit the point of no return again and crash and increase and decrease. And this creates a pattern, almost like a roller coaster. Sometimes we call it the crash and burn cycle of pain. There's a couple of problems with this. The first problem is, as you can see on the lower part of the graph, waiting around for your pain to go away can be kind of boring, frustrating, and it can be depressing. Also, it's a time where there's not much activity, and as a result, the body gets deconditioned. It doesn't get any stronger or more flexible. In fact, it can get weaker and less flexible. So you'll find that activities that you used to be able to do, even with some pain, seem to cause a lot more pain now. There's also some problems with the upper part of the curve. Being able to get a lot of activity done usually feels pretty good. However, what's happening in the brain is that we send a lot of pain information from activity up through the spinal cord into the brain. The brain actually gets better at detecting pain. So every time we hit that point of no return, we go beyond where we have control over the pain, and our brains receive information about the pain, and they detect that signal as very important. And then they direct more energy to it in the brain, making the brain just a little bit more sensitive to pain every time, which we don't want. So how can pacing help? Well, pacing basically involves balancing activities that increase pain with activities that are neutral or decrease pain in smaller portions so that we can achieve a level of control over the pain and continue to do a lot of activities. I would advise you to think for a moment and maybe take out a piece of paper and write down a list of activities on one side that can increase pain and a list of activities on the other side of the page that can be neutral or decrease pain. So maybe like stretching or reading a book or doing a relaxation exercise. All of these activities are activities that could help decrease the pain. And you want to think to yourself, how can I balance these activities? So, for example, with washing dishes, if that's something that increases pain, I wash all the dishes. I'm going to need to lay down for about 30 to 40 minutes, maybe even for an hour. And what I want to do is plan my activity of washing dishes with some other activity that I can use to balance it out. So I might wash dishes for about 3 or 4 minutes because that's the point at which I still have control over my pain. And then I might shift activities to do an activity that can actually decrease my pain. So I might do some stretches, take some slow deep breaths, or even take a short walk around my kitchen. Then I return to washing dishes for another 3 to 4 minutes. And again, switching activities to something that decreases my pain, and then go back and forth in this way. When I finish washing the dishes, my pain is still under my control and I can manage it. And I don't need to take a long rest afterwards. That would be pacing. If you do an activity to the point where you need a long rest afterwards, it's not pacing. When thinking about pacing, I want you to remember the 3 P's. First one is prioritizing, so deciding what is most important for you to get done today. The second P is planning. Planning out your activities so you can get the most out of your day by going back and forth between activities that increase and decrease pain, really having an idea about when you're going to stop a particular activity and what am I going to do when I switch activities. Having a plan really supports pacing. The third P is preparation. So what do I need to be successful with these tasks? Oftentimes, I need a timer to keep track of what I'm doing, and I need to be prepared to switch activities. Otherwise, our natural tendency is just to continue with the activity at hand. Pacing is not really about finishing activities. While that does happen, the goal of pacing is really managing pain, and ultimately you have to prioritize doing pacing well over completing all your tasks the way you used to be able to do it. Because ultimately that will help you complete more tasks in the long run if you don't have to take long rests. So to summarize, pacing is a way to optimize your activity while managing your pain. Thank you for watching, and be well.